Figueroa, and I am the host of Lessons Learned. So I have the privilege today to introduce another practicing physician to you. So let me introduce him. Dr. Raphael Jaramillo is an osteopathic physician specializing in interventional spine, sports, and musculoskeletal pain medicine. He attended undergrad at the University of Central Florida, majoring in microbiology and molecular biology. He then earned a master's degree at Touro College that focused on biological and physical sciences. He then enrolled in a doctoral studies at Touro College of Osteopathic Medicine, graduating in 2015. Dr. Jaramillo completed his residency at NYU Langone Medical Center and at NYU Orthopedic Hospital in the rehabilitative management of orthopedic, rheumatologic, and neurologic disorders. He also completed a fellowship training in interventional spine, sports, and musculoskeletal pain medicine at Rutgers, and also the top national ranked Kessler Institute for Rehabilitation. So bravo to you for all of that.
I've been a Mac guy ever since that was like actually my first computer. So Mac.
Android, iPhone.
iPhone.
Favorite season?
Definitely fall.
Okay. Favorite vacation spot?
Definitely liked going to visit my wife's hometown of Korea. So Seoul, Korea.
Oh, nice. Favorite restaurant?
It's a tough one. It's too many.
You got a bunch?
Yeah, but I just go with very basic stuff. So I guess I'll say like dig in or dig. It's like farm to table type of food.
Okay. So leads me to my next question, which is, do you have a favorite dessert or food? If you think about food like this, where when you indulge, you just feel guilty.
Favorite food that's an indulgent is pizza. Like from New York, a New York slice is like my go-to comfort food for sure.
Okay. So let's move on to media. Favorite TV show?
Oh, there's too many of those.
What are you currently watching?
Currently, I'm actually kind of really enjoying with my wife right now. We watch a lot of reruns of Bob's Burgers. It's an animated show.
I've never heard of that.
Yeah, it's pretty quirky and funny, so we love it.
Okay. Favorite movie?
Oh, that's a good one too. I'd have to say, probably anything by Nolan, but I did like Inception a lot.
Oh, wow. That's my son's favorite too. So your favorite sport?
Favorite sport? I don't play sports, but I do like soccer.
Soccer.
Yeah.
Favorite music genre?
I would have to say, there's a lot of those. I like a lot of alternative music. I guess you could say alternative, or even like folk music as well.
Okay. Favorite color?
Probably just black, as you could probably guess. I tend to wear it a lot.
Okay. Do you have a favorite book?
So yeah, I do like a lot of books so I do like J.D. Salinger. I liked Catcher in the Rye when I was growing up. So I read a lot of his work too.
Okay. When you think about high school, is there any teacher that just stands out to you?
Mrs. Cerny. She was always open about making sure I wasn't kind of like hard set and that I had to fit into a specific, like I guess you could say, puzzle piece, So that's nice. Yeah, very influential.
And when you think about undergrad, is there anyone that stands out? Undergrad professor?
Yeah. I did see another episode where you guys were speaking, and there's actually another UCF graduate. So I did like Dr. Sam as well. He was an anatomy professor at UCF. Very impactful for me and made me love anatomy essentially.
Mm, wow. All righty. Well, listen, thank you so much for sharing that. Thank you so much. All right, so we will move on because I want to now take that dive. We're gonna walk back, and I'm curious for you, when you started to think about the sciences and wanting to become a physician, how early did that start for you?
It definitely started when I was a kid. You know, I know that people usually say that they wanted to be something since they were a kid. Um, and, you know, I was influenced by my dad. My dad was a physician as well. So honestly, I did feel that heavy push, not only kind of coming from a very, you know, in the context of a culture that kind of prides itself in medicine. So, like the Filipino culture, which is what my family is, what I am, we tend to, you know, have such a pride in terms of people going into healthcare, becoming a physician. So, I had that kind of early influence from my parents. My mom was a nurse, my dad was a physician. So,
Wow.
yeah, it's kind of like what
Yeah.
they did.
So, I mean, talking about healthcare was like breakfast and lunch, no?
Definitely, yeah, always is it was all.
Wow. Wow.
Yeah.
That's pretty cool. That's pretty cool. Just in terms of giving a foundation of how people think or how to interact with healthcare. That's I mean I'm intrigued. I'm gonna definitely ask more. Um, and so in high school, if you could share your experience at that level, how was that for you? And you know, did you continue on with your interest for the science, or did you pivot at all in high school?
Definitely. So in high school, I did pivot because my mom, although being a nurse, she definitely in her free time would do a lot of creative art. So she ended up, you know, teaching me when I was young, and then even when I was still in high school, about just being creative. So it wasn't unusual for me to be, you know, involving myself in a lot of music. I did play guitar when I was younger in high school, especially. I played in a couple of bands.
Mm,
I was also very much into doing a lot of digital art at the time when I was in high school. And I think one of my favorite classes in high school was like TV, like advanced TV, where we're doing a lot of editing and making videos and you know, creating a lot of work in Adobe Premiere and Photoshop. So it was kind
wow.
of like my thing that I wanted to do, even though I was still trying to, at the time, gear myself towards something in the sciences. So it's kind of like the two worlds kind of were constantly side by side
Hmm.
with one another. And I definitely had that. It was almost like a, and I'll talk about it more later on, but it was just definitely always present, both sides, the arts as well as the sciences.
Now, at the high school level, were you experiencing any challenges? Did you have to work extra hard in certain areas? What would that be?
Yeah. So when I was in high school, you know, the pull is you have to, you know, people tell you you have to do really well if you want to get into medicine. So when I'm in high school, I was, you know, in that world of both art and sciences, and I will admit that a lot of it was, you know, I could have been easily more focused on the sciences and probably could have done better, performed better, getting into med school directly and right away without problems. But I felt that me wanting to engage in the arts as well was kind of, you know, I would not say it was too limiting, but it was definitely something where my part of my brain was focused on that as well as trying to do the science part. So that alone was its own challenge. I ended up, you know, spending time when I'm not doing anything that was focused on, you know, science-based studies. I would be with friends doing artistic endeavors as well, trying to just, you know, make a video or you know, do video production or anything else. And it was kind of like you know, it was definitely always there, and I just felt that you know, later on it would definitely pose a little bit more of a challenge. So I had to kind of um, in a way become very disciplined early on if I wanted to go into medicine, that I had to kind of focus and put efforts where I could, where I know it would help me out, at least in the medical school process.
And when you were having, academic challenges, were you getting the assistance at home? I don't want to assume that, or did you seek it outside of the home at the high school level?
At the high school level, I was mainly seeking assistance from home. I wasn't getting it outside.
Okay.
So nothing of that sort usually for me. I don't remember. Yeah, I didn't do anything outside. Just a lot of focusing on my own as well as studying. And then sometimes I would get feedback from my dad about certain things. But other than that, that was it.
And from your dad, you're suggesting study strategies?
Yeah. And my
Okay.
mom, they basically taught me to, basically focus at that age.
Mm-hmm.
Trying to, I guess being a high school student, there's a lot of things going on. Your friends are constantly always there as like either support, or they can be something that's a distraction depending on what kind of friends you have.
Yep.
And then even though their intentions are very good, it's still just something that you have to put time aside just for your studies.
Mm-hmm.
And I will admit I found that very challenging for me, especially growing up at that age.
Yeah, that's classic for sure.
Mhm.
Now, preparing to go into undergrad, again, I don't want to assume, did you work with the guidance, or really your parents were the ones like setting you up to apply for undergrad?
Yeah, so it was mainly me wanting to go into that, go that route. And when I did, get accepted into a college, I got into USCF. I was really happy. And right away, when we were selecting our majors, that's one of the first things I did was I selected the pre-professional major, which is for medicine. It's literally, they tell you it's the classes that you take directly to be good with medical schools when you apply. So that's why I
Mm-hmm.
did that.
Okay. So going to UCF, so you're leaving home, first time, how was that transition for you?
Very, I was supported by my family, and they were really helpful in terms of engaging me in my studies. But then, you admit that when you transition out and you're more freer to do what you want, you're more of an adult at that age. There's a lot of accountability for yourself. And it's easy, that part that I talked about earlier where there are distractions, it just kind of amps up in college. At least for me, it did. I had this pull to do a lot of things aside from, focusing on my studies. I wanted to hang out with friends. I wanted to go out and, I liked skateboarding at the time. So I skateboarded a lot with a lot of friends of mine. And in college too, I even got into like photography. So I ended up doing that. A lot of my time was spent on that. And, I will admit, because of that, as a result of it, my grades were not the best throughout college. They weren't like straight A's or anything like that. And I had to
Mm-hmm.
simply focus a lot of my efforts just to try to rekindle that. I think I could speak to it now if you're in the talking about the college part, but
Yep.
engage in activities like that and not really focusing too much my study time. And as a result, my classes, I ended up not doing so well.
Mm-hmm.
I ended up, failing a couple of them because I was just not doing well. And they were hard classes because, this is the pre-medical, huge, like, you have all these students basically competing with one another, and it just becomes very overwhelming.
Mm-hmm.
And, you find like you're like a drop in a bucket and didn't do well. I didn't perform well. And it didn't take until an accident, which is basically the climax that I consider it, where part one divides part two. I ended up having a skateboard accident. I ended up, messing up my femur, and then I had surgery for it. And as a result of it, I almost took it as a sign that, maybe I really need to focus. And so what I did was, I couldn't even do anything anymore. I couldn't skate. I couldn't hang out with my friends. And then as a result of it, I still took my classes. I had one professor, Dr. Borgen at UCF. He was very helpful and supportive. He ended up, helping me to continue at least in his class, despite college life especially. And I ended up having to, I focused, I put away everything else, like the fun that I used to have. And I kind of just, my mom was taking care of me because there were times where, I had to go back home. And, thankfully my home is not too far from college. But at the same time, she had to help me. She was wheeling me like in wheelchairs and stuff like that to my classes. Yeah. And I ended up having, I did well in those classes that I ended up taking as a result of it. Even though I failed it, I had to, take them again. And then I did better than I did before. And I was just really happy about that I was able to turn it around. I will admit though, my GPA still wasn't what they consider medical school level. And, I still used, I still took that upon myself still to look for other options at the tail end of college as I was applying to graduate programs and medical schools that offered graduate programs, which includes Toro.
So let me ask you, just to stay with undergrad for a moment.
Sure.
If you were to give advice, having had the experience you've had and knowing the seductiveness of, young people wanting to engage in multiple activities of all sorts when they break free of home, what would you advise yourself if you had to redo it? Right?
Yeah, no, I would definitely tell myself it's worth it to put time aside. Even if it's just set time that you can honestly just to put time aside to focus on studies, because it really, all that stuff, I do love my friends, I do love the experiences I had, but I feel that it's more rewarding having built the time that I did put towards studying. And I'll definitely talk about later when medical school comes, but when I put more time towards studying, I felt that was much more gratifying that I actually did that. I actually was like, I was actually thankful to myself in the past that I actually disciplined myself and actually like woke myself up in a way that I had to kind of turn things around. And if I didn't do that, I don't know where I would be. And I feel like it was that drive and that overall discipline in those small times where I had to put distractions aside that I was able to come out. And because of that, looking back, I don't remember the skateboarding and all that stuff. I don't remember the, like events that I go to or friends I hung out with. It just becomes, it just kind of, disappeared from my mind. The only things I remembered really were those moments that I actually put time aside that launched towards my, overall career. And I think that was majorly important.
Yeah, no, it's interesting. It's good for young people to hear too, like we acknowledge that there's a time and place for everything, and you can have your fun time too, but it just can't take over everything. So I think sometimes that's what happens. So yeah, I'm glad you were able to pull it together, and you had your fun. You had some fun, but you also achieved greater than that. So let's move on to now you've gotten through undergrad with some challenges. You figured out how to get past them. Applying to the doctorate program, who was working with you to prepare for that?
It was mainly.
Oh, and I do apologize.
Oh yeah, sure. Yeah, no problem.
Because the before the doctorate was the master's. So
that's what I was going to ask you. Yeah.
Yeah. So let's talk about that. You made a decision to go for your master's, and what was your thinking then?
Yeah, I wanted to see other ways in terms of like, if I were to boost, take the momentum I had in undergrad, the tail end of undergrad, where I tried to, make up for the lack that I had. And I ended up doing that. I ended up applying to master's programs to see if there was any possible way that I could use that as a way to, get into medical school. And I felt like I was able to do that. At least there were a couple of programs that I was definitely looking at, like post-baccalaureate programs. And they were, it was good, and I ended up, putting the application into Toro as well. And I just, when I got the, I think I got your letter. I was really ecstatic. And so essentially I had to change everything. and I had to move and everything like that. I had to prepare. And overall, I felt like it was a good opportunity, and I wanted to use that momentum to kind of build on what I had been doing.
Now, I'm curious, since I don't have your application in front of me, so can you share with us when you looked at your profile at the end of undergrad, what did you see that you didn't like that you felt warranted going for the master's? Like between the academic GPAs and MCAT, you looked at that and felt, I need more. What was that? What did it look like?
I really focus a lot of my energy in order to pass a standardized exam or do well in it. And I always kind of was very jealous of the people that can just kind of, at least they appear to not study as much and then they do stellar. And I'm just like, wow, I wish I was like that. I'm not like that. And I'm sure that some of your listeners may find comfort in that. Definitely not everyone's perfect, and I'm definitely not like that. So one thing for sure that stood out, I definitely needed better. Like I didn't have a good MCAT score. It was like, average. And
okay.
It wasn't, something they would consider like easy in medical school. And that was the main reason also that I just needed. And my GPA was also lacking, like I told you. It wasn't, it was a lot of damage was done in the first half. And I was kind of trying to recuperate in the second half. It wasn't able to, obviously because of the damage that was done, it wasn't a stellar GPA. So both things, those two main things, which are obviously the two main things that people look at on the application, those things needed work. And I wanted to see if, that's the reason why I went into a master's program, to see if I could try to, make up for my lack on those two things.
You get into the master's program. Could you share what that experience was like, and did it help you?
Yeah, the same classes that medical students took. And it was basically like a trying, like a ground of like, like a trial where you can do these classes and you had to perform, very well in them. And if you could maintain a GPA above it, a certain GPA, that you would be, considered definitely for the medical school. And I was like, this is my shot. I needed to go and do this. And then I used that momentum that I had at the tail end of college and just basically focused. I settled in. Obviously the move was very different. I grew up in Florida, in Central Florida, like in a suburb. And then here I go right into Harlem, New York. And I'm like, wow, this is a huge culture shock to me. Everything. I, found a place on Craigslist in like probably a couple of days after, just staying at my uncle's place in Jersey, just trying to, email people on Craigslist about rooms available. And I remember found like this one, and it was perfect to me. And like, I just was like, I just need to get it done so I can, focus. And, got situated on 129th Street, just down the street from the school. I used that opportunity, that proximity, being there, to spend a lot of time that year for the master's, focusing, studying. So I ended up just spending. It was like literally, I think I spent more time at school compared to my home, my apartment. I was living in those study rooms. I was, thankfully my friend. I grew to have some friends in the master's program. We studied together. We all had the same outlook, because I think that whole idea that, given that potential for that second shot, and I think that energy that we had all together is what propelled us to, perform, study well, and then also perform well in at least the exams, and try to do a good job. And all that was mainly just a lot of studying, a lot of focusing, and trying to comprehend the material, trying to understand it and apply it. And that year I think was very crucial, because it not only helped me in the master's and then my transition to medical school, but it helped me even throughout like my medical school training, like being able to taking those principles of good study habits is what I carried on. I still carry on today, at least with those things.
So, I mean, between the master's and then getting into the doctorate, like that's a big shift from undergrad. And so I'm wondering, in terms of your like evolvement, how you needed to study to be successful, what were the major things you had to change?
Yeah, but then in masters and then eventually in medical school, I had to learn to say no to a lot of things, and it was kind of tough because it kind of well, people would think it would jeopardize friendships, and it kind of does. I will admit it. It just a lot of that though. They knew my friends were good enough to know that it was important to what I was doing, what I'm trying to focus on. So I made that clear. It was basically just saying sorry, saying no to a lot of things, which
Mm-hmm.
included, I wanted to hang out or at least wanted to talk. I had to kind of take away that distraction. And, a lot of it also turned out to be just putting myself in an atmosphere of people with a like mind. I think that was important because, it's easy to have friends that you have, and I'm sure a lot of the listeners can probably relate to it. If they're going into medicine, they're going to have a lot of friends that are not in medicine, and they're going to have, they don't have the same things that you have to go through.
Mm-hmm.
They have their own lives as well, and um, going into medicine is definitely a hard thing to do. It's very challenging. You have to say, not only like you have to say no to your friends, but you have to put that time aside and put that effort aside just to focus on your studies. I
And
think
if I
that,
may,
yeah,
yeah,
go on.
if I may ask you, for as it
Yeah.
applies to your studies, the way in which you studied for undergrad and then your master's, I'm sure you felt the shift of that. What did you really have to change at the doctorate level on how you studied? Did you do it independently as a group? Like, did it vary? Tell me.
I think having a group was helpful more compared to what I used to do. I was somebody who used to study by themselves. That back and forth between a person, you guys end up understanding the concepts way better. And you
Mm-hmm.
always remember a conversation that you had about something, or like if you're trying to memorize something in the citric acid cycle, you'll remember something funny that a group member shared about something. You'll remember certain things that are important. And I think the major thing for me was changing that. I think that went from being in isolation to going into a group setting, and I found it very valuable.
Curious, what kind of learner have you found yourself to be probably at the doctorate level? Um, did it change for you? Like, are you more of a visual learner? Like, what kind of learner are you?
It's definitely visual. I think it has to do with that artistic side that my mom kind of incorporated into my life early on. I think she was very, she was kind of like always making me draw things, and I always felt like I was wanting to draw to understand something better. So I was, and I definitely still do it now at the doctorate level. I draw for my patients sometimes something that's going on with them, like
Mm-hmm.
if they need to understand what's going on. And thankfully, like I'll make sure to ask them, does this make sense to you? And they'll definitely tell me, yeah, this makes total sense. I didn't realize that's what it was about. I think that me being able to do that helps the patient to understand better about their condition, and in essence they become their best advocate because they understand their pathology, and so they can at least try to vouch for their care, the quality of care, even after, long after they leave my office. When they're seeing another doctor, they know what's going on.
Okay, so you complete your doctorate, you go into clinical. No, before you, excuse me, back it up.
Mhm.
You're going through the doctorate program. You begin to go out to your clinicals. How was that experience for you?
Yeah. So definitely, it was, to say the least, it was like the real world. Third and fourth year, it just becomes like a roller coaster ride. It's almost like you're having to really force yourself to apply what you've learned in those years into the clinical setting.
Mm-hmm.
And it's very it really challenges you in many different ways. Not only in terms of your knowledge, but you become so aware of how you present yourself to other people, patients, and you learn very fast your weaknesses. Like learn very fast about how you come off to somebody, even if you have the best intentions, even if you're very good with your knowledge. You learn very fast either by the patient themselves or the peers that are reviewing you, like residents or attendings. That whole realness aspect, you realize very soon how you have to change, either change or improve yourself for the better to become a better physician. So I think it was a really big roller coaster ride. I ended up learning a lot about myself, aside from learning a lot from the physicians and the residents who guided me through those 2 years.
If I may ask you, the specialty that you chose, why did you make that decision? Curious.
Yeah, so the official name of it is physical medicine and rehabilitation. I ended up choosing it because I wanted to understand more about the pathology of um, neurological injury. So I ended up wanting to officially go into PM&R because my dad had a stroke in 2009, and I kind of wanted to use that as a way to take care of patients, very similar in that setting. And I did. I ended up doing the exact same thing, teaching and understanding, brain injury, neurological rehab,
Mm-hmm.
those kinds of things. I ended up going into the field also because I had a strong interest in doing pain management early on. When I was an intern, I spent time with a physician to be able to fix something and give their quality of life back, which is a
Yeah.
huge theme in PM&R. Improving person's quality of life is even despite physical impairment or injury. That's a huge reason why I went into it. I wanted to do that for others.
Okay. All right. If you can give me a day in the life for you so that we can conceptualize, what's your experience as a practicing physician?
Yeah, let me see. So I work right now in Queens in private practice. I wanted to have my weekends available. We work about normal office hours, 8 a.m. to like 4 p.m. And it's pretty good. We usually go, for me, I see patients throughout the day. I see new patients and follow-up patients. And then several days of the week, we're doing a lot of procedures. So if the patient needs, let's say, an epidural steroid injection for something like lumbar radiculopathy, which is the pinched nerve in the spine from like a herniated disc, then we will set them up for the procedures on those days, and we'll do a lot of procedures. It's very heavy in terms of volume, um, you know like 50 to 60 injections, like in those couple days. And it's impressive because you're taking care of people right then and there, and then you're following up with them soon after. And for me, I just like seeing those follow-ups throughout the day where I did a procedure, like an injection on them or like a procedure on them the previous week or the previous 2 weeks, and they were like completely changed. It's just having that ability to fix something was what made it so gratifying. We lesion the nerves that cause pain in the spine. And then we also do minimally invasive procedures like discectomies and also spinal cord stimulators. So it's pretty cool because we use a lot of cool technology,
Mm-hmm.
um, pretty much new on like state of the art um, technology that's kind of like being tried and having good results, and we incorporate it into the practice very quickly. So I like it because I'm able to do something so fast and get approval from an insurance company and help someone out of pain. It's very great. I like it.
Okay. Well,
Yeah.
listen, thank you. To end, I would ask if you were to, we did a little bit of this already, but if you were to speak to your younger self, what would you say to your younger self now?
Yeah, I would definitely say to my younger self as well as your listeners, I think that extra time aside to kind of study, to focus on studies, and just have discipline overall in terms of what you're doing. Having to make up for my lack, I had to, repeated classes, and I had to um, take over for things, and You have to have the determination as well as the discipline just to keep on trying, and you will succeed. It's just that it won't be a straight path as everyone expects, and people will expect a straight path from you, but it's not going to be. You don't kick yourself if you don't find like you're appeasing somebody right away. Overall, um, I want to encourage them as well, and then that's what I would say to myself, that despite the rocky road, keep that determination.
Alrighty, so this ends this episode. So we appreciate you and your time, and we see you guys next week. All right, it's been a pleasure.